Morning. I just wanted to come in and talk about things that are on my heart and thinking about my past history of public health. The subject really is public health and what it means to me and how people may not understand how it's been protecting them for all these years. And so, as I'm thinking about my colleagues at CDC and at HRSA, and all the other departments that's been impacted by the government RIF, I just want to say thank you. And I say colleagues because I do truly believe that all the people in public health are my colleagues. My name is Dedra Spears Johnson, and I'm the Executive Director of Heart to Hand, but I've had a long history in public health. I started my career out in 1990 at the Centers for Disease Control as a public health advisor. And back in the 90s, we were so committed. We were so young, committed to fighting the HIV epidemic at the time. And we were sent all across the USA. I was sent to Florida, and I met some wonderful people that had been sent there. And we were trained as public health advisors to go into the community to support the members of the communities who were impacted by HIV. And we did that. We did that enthusiastically. We did that thinking that we were going to save the world. We put ourselves at risk at times, but it didn't feel like it. It didn't matter. We were there to support the community, to improve people's health. And HIV at the time was a death sentence. There were not as many medications. People didn't have the access that they needed, and people were dying. And so my colleagues and I, we were committed to changing the destiny of those individuals impacted by HIV. And we did. And we were able to educate, we were able to connect people to services, we were able to create community, we were able to create families within the CDC as well. And as my career progressed, I was there for about 7 years. And they sent me here to Prince George's County, where I am now. And in Prince George's County, we did the same thing. We created community. We were able to educate throughout the state of Maryland, throughout the region, and we created connection within the health department. Also, we created connection within the community. We helped people to remember and to um, understand their disease, the HIV at the time, and understand that they could live with HIV and their lives were changed. Fast forward today, I am the founder and executive director of Heart to Hand, and that all came from my experience with CDC. I wanted to start something that would continue the legacy that I started at CDC. I wanted to impact the community in a bigger way, in a way that was family like, community based. We saved so many lives. And so, with Heart to Hand, I've been able to extend that desire and legacy that was started at CDC so many years ago. In full circle, the organization is a partner with CDC through grant funding. And so I just want to say thank you to CDC and to my colleagues, those that I've worked with in the past, those that I currently work with, and that I want to remind you that you are the person, the same person with that CDC title or without. And so I want you to keep the faith and know that you can create new things, and you can use those skills that you have to build something bigger, better that can impact the community in a greater way. And so I look forward to working with any of you. Feel free to reach out to me, and let's talk about what your next idea, your next role, your next thing will be. And I just want to say thank you again.